This podcast is for general information only. It is not intended as a substitute for general healthcare services. If you have medical conditions, you need to see your doctor. Use of this information is at the user's own risk. Welcome to FitRx with Dr. Greg Dennis. Join me as we challenge the standard sick model of healthcare. This is your source for everything health, wellness, prevention, fitness, biohacking, and more. Hello, everyone. Welcome to another edition of FitRx. I'm your host, Dr. Greg Dennis. Excited about today's topic and conversation with another physician here who really specializes. He does a lot of stuff, but specializes in something called precision medicine, which we're going to talk about. So Dr. Dan Stickler, who is the co-founder and chief medical officer for the Apeiron Center for Human Potential, and he's the chief science officer for the Apeiron Academy, the visionary pioneer behind systems-based precision medicine. He is also an author, speaker, blogger, podcaster, medical director of Neurohacker Collective. He's a consultant for wearable technology, as a guest lecturer at Stanford University. So really smart guy. And so just excited to hear what he has to share with us today. So Dr. Stickler, welcome to the show.
I'm glad to be here, Greg. And call me Dan, please.
Okay, very good. Okay, let's start. So you were once a general and vascular surgeon, is that correct?
Yes, I'm reformed.
Okay. So talk about that journey, if you will, of how you went from a surgeon to kind of getting into the anti-aging, and you're doing some really cutting edge stuff, which, we'll go into a little bit, but talk about that transition for you.
Yeah, I mean, it was really a misperception of what I thought medicine was. I got into medical school, and it's all I ever wanted to do was to be a doctor. But I saw doctors because of my pediatrician that I had. I saw them as like really working with you to improve health, because he would always talk to me about, my baseball game or my football, anything that I was doing. He would talk to me and he would give me ways to be better at what I was doing. And I just thought that was the coolest thing ever. And I get into medical school and realized fairly quickly that it was about sickness and pharmacology. And it was pretty strongly disenchanting. But I thought, well, maybe I can find something that will really resonate with me. And so I'm going through the process, and, in third and fourth year, you rotate through all the different rotations. I actually really enjoyed psychiatry. That was one of my favorite. But everything else was like a stepwise postponement of death. People would come in with an illness, you'd intervene and you stabilize them until their next drop. There was never this, they're dropping off, now let's lift them back up. Surgery at least gave me the option to take people that were at baseline, they have an event occur that drops them down in quality of life, and then I intervene and I can bring them at least to baseline typically. I started doing some weight loss surgery, laparoscopic gastric bypass, did about 3,000 of those operations while I was a surgeon. And those were ones where I could actually intervene and improve quality of life for someone. So that was rewarding for me. But it was in 2004, 2005 that I decided to take a course on hormones. It was because of all these obese clients that were coming in that had major testosterone issues, and I wanted to learn how to manage it. Well, I found Epigenetics at that time, and they were doing the stuff that I thought medicine was about. They were working with nutrition and fitness and hormones and really optimizing the human system. So I dove deep into that. I heard Aubrey de Grey give a talk at that event, and everybody thought he was crazy, but I was just enthralled. It was when he first presented the 9 hallmarks of aging, and I was just blown away. I was like, oh my God, why does nobody know about this stuff? It's interesting because just 3 years ago, I was on a panel with Aubrey, and I got to actually spend some time with him over the weekend, and got to tell him about his influence on me. So it was cool to actually get to tell him that. But in from 2005 until 2010, I was doing this age rejuvenation, age management, whatever you want to call it, anti-aging, as a hobby with my surgical practice. And then one day, December 31st, 2009, I took my gown off in the operating room, and I just made the announcement that I was done. I was retiring at the, how old was I back then? That was 44 years old. Wow. So I was retiring from surgery after just basically 10 years.
So did your colleagues think you were nuts?
Everybody thought I was nuts, except my wife.
Okay.
My wife knew I was not nuts. It was just such an amazing transition for me to actually commit to it. Financially, it was rough. I mean, you go from making $500,000-$600,000 to making $57,000 my first year of doing age management work. And I just knew it was gonna be something big, though.
You started doing that kind of thing, and I guess that has evolved for you over time, and now your specialty is kind of more precision medicine. And I know a lot of people are familiar with age management or anti-aging medicine, and they've heard the term functional medicine, but I don't think as many people are familiar with precision medicine. So talk about what that is exactly.
I guess the best way to describe it, because it's used predominantly in oncology. So for cancer treatments, they've co-opted the term precision because they use genetic data to work with clients on that. And when we first started doing precision medicine, that wasn't the case. So now I really focus more, call it more systems-based or integral medicine, something along those lines, because what we do is we look at the human system as the complex adaptive system that it is, rather than looking at it as a complicated system, which is why we have all these algorithms in medicine that don't work, because the thinking process is wrong. I mean, there's never a root cause of anything in a complex system. There's all these things that contribute to what output occurs in the system. So really, precision medicine for us is about data. The more data we can get, the less uncertainty we achieve. So by getting as much data on a person with their genetics, their epigenetics, their blood work, their urinary metabolites, their brain mapping and gut biome, all of this stuff, and we put it together and we say, what does this picture look like when everything's put together? So a truly holistic approach. But it looks at it without a context of looking at disease. So we're looking at, here's the human system, what's in balance and what's out of balance, and how can we first balance it, then optimize it, and then potentially enhance it to some point. All of our clients wear the Garmins. I don't have mine on right now because it's charging, but all of our clients wear the Garmin watches, and I get data on them daily of resting heart rate, stress levels, sleep, recovery, heart rate variability, all of this that I can monitor on them every single day. And what I do is I get on a call once a month and we look at all this data. We say, okay, what was happening here? You can see here where your stress levels started to climb, your sleep dropped off, and we can identify lifestyle factors in there that can guide them better in identifying what is impacting the system from a N of one standpoint, which is really been game changing for our work with clients.
So talk us through that a little bit more. Say, a new patient, is working with you, or I don't know if you see them in clinic or do more virtual stuff, but are you going to get just kind of traditional blood work and as well as a lot of genetic markers? I mean, what all are you going to do? I mean, take us through, if you just like a typical patient that you would see.
Okay. So after we have met with them, most of the time virtually, some will come in to meet with us before live, but the once we've agreed to work with them, we get them set up so they have this long intake process that they go through with the paperwork for the intake, and then they have to get their blood work, which is looking at 112 biomarkers. So it's a pretty extensive blood work, looking at inflammatory markers, metabolic markers, hormones, the whole gambit. We get their methylation data, so looking at their biologic age, looking at impactful loci on the methylation age, which means, are you predisposed to anything based on methylation patterns? We get their genetics, and we have an 85-page report that we created that analyzes around 450 genetic variants in different categories. So we have that data. Then we get urinary metabolites, look at hormones, and look at the adrenals. Get a quality of life inventory, a health consciousness scale. We do a cognitive executive function test, and then we do a cognitive behavioral test. Then they complete that part, and then they're ready to come into the office for their 2-day visit. And in the 2-day visit, they go through neuromuscular mapping of the entire body. They go through a DEXA scan for bone density and body composition. We do a full QEEG brain map. We do a psychophysiologic stress profile, which is basically looking at the autonomic nervous system, looking at how they respond. It's like a lie detector, but it's looking at all these parameters when they go through a stressor, and we can see what's happening. We look at their breath mechanics and their carbon dioxide levels, also during stress. We do a balance and movement assessment, and then they kind of sit down with me or their clinician. And it's usually over the 2-day period, it's about 4 hours of FaceTime with the clinician. We have a dietitian on staff that goes over all their dietary patterns. So yeah, it's a lot of data. And then when we finish that, once they've done their 2 days in the center, their primary clinician will present them to the whiteboard. And on the whiteboard, we usually have 10 to 12 of our staff in the boardroom or coming in by Zoom. And that person is presented with all of their data, and the clinician that's working with them will say, "This is what I've been thinking," and then everybody gives input. So we have a transpersonal psychologist on staff. We have a nephrologist. We have an anesthesiologist. We have a couple of health coaches that specialize in either fitness, nutrition, or neuromodulation, neurofeedback. We have a dietitian. So a PA, a nurse practitioner with different specialties. So everybody is giving input as to what they think is going on. And it's so funny to see how often we miss things that are obvious to other people. I've trained most of these people in my clinic, and I still will present a case, and they'll say, "Well, did you think about this association with this and this?" And I'd be like, "No, I didn't, just completely missed that one." So it's nice to have all the different brains kind of contributing and interacting with each other and determining what's happening and what the next steps would be to help the person.
So that's pretty involved.
Yeah,
but that's a lot more than, just your typical, physical that somebody, goes and gets. So
right.
What type of clients are you seeing? I'm assuming these are kind of high executive type people around the country. Is that who kind of seeks you out?
Yeah. So right now, our costs on this program are obviously pretty high. So our programs they're year-long programs starting at $24,000, $36,000, and $60,000 for the year, depending on what they want to do. The clients that can afford it are usually the high achieving executives, entrepreneurs. We've got a couple of really well-off families that just bring their entire family in. But what we're doing with this is informing us for for being able to take this to a wider audience. We just launched a telehealth program that we can manage for about 3,500 for 4 or 5 months, so that people don't have to, fork out the 24,000 to work with us. And I see that eventually coming down even lower and lower. We're working predominantly with the health coaches that we've trained, and using the clinicians as just kind of the support in those programs.
So what kind of stuff are you finding? I mean, I know it's obviously highly individualized, but with what I do, I mean, almost everything, which isn't near as advanced as what you're doing, but I mean, almost everything can come back to lifestyle. So I change up their diet a little bit. You get them to exercise, lose weight, maybe optimize their hormones. So, I mean, that's probably all kind of the foundational stuff, but are there just kind of typical things that you're doing on most clients, or is it just extremely individualized? I mean, what are some of the, I guess, the extras that you're doing a lot of?
Yes. So most of our focus is on age rejuvenation. So people will initially go through getting balanced and then optimized. And then with enhancement, we start looking at more of things that will mitigate the aging process. So we use a lot of work with senolytics, class of medication that's designed to take out what we call these zombie cells in the body. We work with rapamycin in almost all of our clients. We work with peptides, various peptides, to achieve different outcomes with people, which, I mean, peptides are not well known in the medical community, but they're, for me, they have the profile that is very safe, and in fact, in most cases, safer than most medications and supplements, because they're so directed and the body's so familiar with them. And there's a lot of them out there. I think there's like 64 different peptides that are available right now through that have gotten FDA approval, and yet not a lot of people do it. A lot of that's because of it's an injection, and they don't like to have their patients injecting themselves.
Do you have a few favorites? I do a few peptides. We don't do a ton here, and I know it seems some of them are getting harder to get than they were a few years ago. But do you have a few favorite peptides that you like?
Yeah, I mean, most common ones are going to be the thymosin beta 4, thymosin alpha, BPC 157. Mostly those are kind of healing peptides. And then we use quite a bit of semaglutide, and now tirzepatide, which is the weight loss peptide. And tell you, it's been, I was in the weight loss industry, and this is a paradigm change for weight loss. Peptides are a whole new class where you don't have the stimulatory effect. You have insulin sensitization, you have appetite suppression. I mean, it's just it's a win across the board. And in fact, some people in the age rejuvenation community are using these weight loss peptides for their anti-aging capacities, because they sensitize insulin receptors in the brain. They sensitize insulin receptors throughout the body. It's just a really good, I think, intermittent use to help achieve better aging.
Okay. What about the growth hormone like peptides, the ipamorelin, sermorelin? Do y'all use a bunch of that kind of stuff?
Yeah, we do, but that's become less and less. I mean, if we do use them, it's typically using something like the CJC rather than tesamorelin, and mainly because tesamorelin tends to really increase IGF-1, which is not necessarily ideal. I mean, IGF-1 is that double-edged sword. Too little is not good, and too much is not good. And we found tesamorelin really increases IGF-1 quite a bit, whereas CJC is one that really works well with the body in allowing the body to maintain that growth hormone level in kind of the Goldilocks zone, so that you're not getting too much or too little. That's been our go-to with that one.
And so a lot of what you're recommending based on these patients' results are certain supplements. You mentioned the senolytics and things like that. So you're gonna design a plan for them, and give them recommendations on supplements and
Yeah.
obviously lifestyle and all that, correct?
The standard, we put everybody on a low dose multivitamin, vitamin D, B12 injections, and fish oil. I mean, that's our foundational line of supplements. We started a supplement company to support that, and we actually call that our foundational line. Those are the ones that are in that class. But then we have a biospecific line, which is designed around, supplementation for specific characteristics of that person. So that's where we use like niacin or methylfolate, something that's directed at what they've got going on specifically to them. And then we have our performance line, which is more for kind of upgrading different aspects of the body. And then we have our longevity line. Really excited about a new product that I formulated recently that is a combination of my favorite longevity supplements that I used to take 12 pills a day and spend $450 a month to get. But now I've got it all in 3 capsules, and we sell it for $149 for a month of it. So it was a huge cost savings for me, and it's been one that people have been really drawn to.
And what's the name of that one?
It's called Aeon, Aeon.
So, you've been doing this for a while. Give us some, I guess, kind of foundational tips as far as how people can live longer and maybe increase their health span. I mean, obviously there's supplements, there's a lot of stuff, but I mean, give us kind of your recommendation on just foundational stuff.
I mean, if you want to look at your best return on investment, it's lifestyle by far. Nutrition, fitness, sleep, and stress. I mean, you work on those things and you've taken care of 60% of what's going to be responsible in the aging process. In fact, I think medications have shown about 10% impact overall, although I think that's going to be changing with some of the newer techniques that are coming on the market, like the cellular reprogramming, the nanobot technology. All of these are really exciting. Plasmapheresis or plasma dilution. Those are making a big difference. But baseline, I don't know. I've just gone through a life transition of what's important for me. And this is one of the things that we work with. So over the last 20 years, we looked at why people came to us. Why were these people spending $60,000 to work with us in a year? And we basically found 5 categories. One is the body. So their body is not in the shape that they want it to be in. And what I mean by that is, the physical body is the vehicle of consciousness, and that's the way consciousness gets around right now. So you've got to have a body that can respond when you want to do something. 2 is really the mind. And this doesn't just mean like maintaining healthy cerebral function or brain function as we age necessarily. It also means really working to eliminate those mindsets of deficiency. So we have very common deficiencies that we see in finances in our patients, which is crazy when you're thinking about people are spending $60,000 a year. Some of them are worth well over $500 million net worth, and they still worry about money. It's a concern for them. We also notice that people will have concerns about their value to the community. We'll see people who have not found love as a big thing. People that just don't have peak experiences where they experience awe and gratitude on a regular basis. And people that just don't have a purpose. I mean, those are our primary areas that we end up working with clients, because the one thing I found is our quality of life inventory is a test we do to get an idea of what their quality of life is. Is it average, above average? Is it low? And we rank it along all these categories of family, friends, money, health. So there's all these categories. That has been our biggest marker for us being successful with a client. more so than any lab work or, body composition goals, anything like that. People felt that they really accomplished something when we focused on those quality of life issues. Because, it doesn't matter if you fix somebody's thyroid numbers. If they don't feel any better, they're not going to be happy with what they've got. And that's what we look at. We look at what is creating quality of life for the person. What's their relationship with the exposome, their environment, the biosphere, and how they interact. I have a friend, Mario Martinez, he does kind of evolutionary biology, but he's a psychoneuroimmunologist. He visited all the blue zones, and he looked at, what is it in these blue zones that keep people aging so well. And everybody thought, well, maybe it's diet, maybe it's, movement, exercise, sleep. None of those have really panned out, because you look at the different blue zones and they have very disparate diets and activity levels. What he found is the common denominator is, one, a mindset of self-worth that these people have. So they see themselves as valuable. And two, they have a community that is supportive and friends. Number of friends is highly predictive of how well you age, and how often you see those friends. So we try to work with people in those areas too. It's not just limited to the quote medical piece of it, but those are areas that people just don't really think about.
So I ask this question a lot, especially for people like yourself who, been in this field for a long time and really study aging, or anti-aging rather. But so give us your kind of daily regimen. What does your day look like as far as, the type of exercise you get, types of food you're eating, what you're doing for stress? Maybe you don't have to go through all your supplements, but maybe, your top supplements. What does that look like for you?
Well, sleep is the highest priority for me, for sure. I really focus on sleep, and we go to bed at 9 o'clock every night, and we usually wake up between 4 and 4:30 in the morning. And that morning time is so valuable for us, because from a relationship standpoint, we spend 3.5 to 4 hours every morning in bed together. We'll do some meditation, but then we'll make love, we'll massage, we'll just talk about the day, whatever it is. And we've been doing that routinely for almost 4 years now. I don't think we've missed even, 10 times of doing that. And that was just mainly because we were flying or something. But that's been our routine, and that's been the healthiest thing that I've ever encountered. My sleep profile looks really good. Sleep is an interesting one though, because, everybody says you want to get 8 hours of sleep, but yet the data, when you look at like Fitbit's billion nights study, where they looked at where the resting heart rate was in relation to the number of hours slept, and 7 hours seems to be the ideal time. And I find that for myself, that 7 hours is ideal for me. Half an hour less or half an hour more, I tend to not feel as well, and my resting heart rate is higher. So you get that U shape on the resting heart rate. They also found that cognitive performance tests, the 7 hour point was also the sweet spot. So I don't know. I think that, I have a good friend who's a sleep doctor who just chastises me every time I say this, but, I think that we need to relook at this 8 hour minimum requirement that stresses people out, and focus on really, the quality of the sleep that they're getting.
So any biohacks on sleep other than kind of keeping a rhythm? Any, magnesium, anything like that you usually recommend your clients to help with?
Yeah, my wife tends to use, magnesium at night. That seems to work really well for her. I don't generally require anything. I just require being on a schedule. Having a set time to go to bed is the most important thing, not necessarily set time to wake up. So we haven't used an alarm in 6 or 7 years, and we can predict when we're going to wake up almost every day, because we go to bed at between 9 and 9:30 every single night. There's no variation in that. So the body knows it's going to bed. And the reason we did that is we were looking at it and we were like, well, what are we doing at night between dinner and bedtime? And most of that time was spent watching TV, not even communicating. And so when we switched to doing our morning routine, it was amazing how it improved our relationship, how it improved our communication. Life just felt so much better doing it that way. And I've had several people that have adopted that approach and found a similar outcome with it. As far as exercise, try to get some running in a couple days a week. I'll use either free weights or the tonal machine a couple days a week. I'm not as aggressive as I used to be. I mean, I used to maintain like an 8 to 10% body fat, and it was so much work. I mean, it was like 3 to 4 hours a day and really over stressing on the eating, which was not healthy either. And now I'm much more lax on that. I'm more forgiving of myself. The stress, I really have no stress in my life. It was funny. I totaled the Range Rover the other day here in Sedona. We had driven it up here because we were staying here for a month, and I was helping a friend get to a shuttle pickup, and the car just went right into a ditch and took out a fence, split rail fence, and then hit a tree. Totaled the car. Nobody was hurt in the car. And I was looking at my Garmin and the data from the Garmin, and my stress level was completely non-stressed. My heart rate hadn't gone up. I hadn't stressed at all. That was nice to see that my mindset around this has been one of the biggest impactors of it. I mean, we create so much of our own stress. I mean, it's just life, and it doesn't have to be.
Any particular diet that you adhere to?
It's funny because I used to have a website. Matter of fact, my original podcast was the Paleo Doc. So I was a very paleo oriented nutrition, and I have just not been a fan at all of all plant-based nutrition. Over the last couple of years, I've shifted to a more plant-based diet and less meat, especially red meat. So focusing on the fish and really some of the leaner red meats on occasion. But the biggest thing has been shifting to eating more plant-based.
So you're almost like a Mediterranean, kind of leaning that way,
Yeah.
sounds like.
Yeah, I do kind of a modified Mediterranean, I guess would be the best way to put it. A lot of olive oil, a lot of fish, and a lot of vegetables. I don't do as much grains as the Mediterranean diet, the typical Mediterranean diet, but that's the one that I found from the research seems to be the best for longevity. And from a genetic standpoint, when I look at people's genetics, it seems to be the one that matches best with the bulk of the the people with the genetics in our client base.
Mm-hmm. Now, do you purposefully incorporate any intermittent fasting, things like that?
I don't. Used to, and then when you do something regularly, the body can adapt to it, and they found that the best form of intermittent fasting is where you just throw it around every day. So one day you'll eat breakfast and dinner and fast in between. The next day you'll eat lunch and dinner and fast in the morning, or you'll eat breakfast and lunch and then fast for dinner, and then have a day where you eat nothing or eat one meal. Throwing it around keeps the body from getting accustomed to a routine where it adapts to that routine. But what I've really been working with most of our clients is learning the signals of hunger and just eating when you're hungry and not by the clock. What most people find is that they're not really actually hungry in the mornings. It's just more of a habit than anything else. And so a lot of people, once they start paying attention to it, they tend to not eat before 11:30 or 12 most days.
Do you still host a podcast now?
We're just relaunching the podcast. Yes.
Okay. What's the name of that?
Life of Excellence podcast.
Well, okay, so you've got that going. You've got the clinic, which I guess if people want to find out more about the clinic, they can go to Apeiron. That's Apeiron ZOH.com. Is that the correct website?
Apeironzoe.com. That means limitless life.
Okay, apeironzoe.com. And then you mentioned that supplement, Aeon, am I saying that right?
Right.
That you like. They can find that at apeiron.store. Is that correct?
Yep.
And I think we will have a code for the listeners that I will put that in the show notes when this podcast is released. So be looking for that.
Great.
If that's something you're interested in. Anywhere else that people can follow you on Instagram, anything like that? I mean,
we have a YouTube channel. It's under Apeiron as well. We are getting more involved with Instagram now that we have younger staff members that actually use that.
Sure.
We were stuck with the LinkedIn and Facebook, and then I haven't been on Facebook in probably a year and a half now. But you were really liking the Instagram piece. So if you look us up there, it's just Apeiron.
Well, anything else you want to throw out there before we kind of wrap up?
No, I mean, I'm glad to see the younger docs in the generation actually going this route. It's been something we've been very much advocates for, is this more comprehensive health and getting away from sick care. We've been preaching it since 2012, and it's finally we're finally starting to see it come to fruition with a lot of these organizations.
Well, I'm fortunate that, I mean, my listeners have heard my story, but I'm fortunate that I feel like I just kind of had the veil lifted from my eyes, and I just because I used to practice as normal doctors did, just throwing out medicines, and I just finally realized one day that it wasn't working, and it baffles me now that so many doctors go through a whole career and they just don't even take a step back and assess what they're doing and the outcome of their patients. Because when I talk to doctors about what I do, and I'm like, if you look at what you're doing, are your patients really getting better? I mean, and I'm not talking about their lab numbers, because their lab numbers may be getting better. And that's what I discovered. Like, people's A1C, was where they were supposed to be on all these medicines, and their cholesterol was normal, but they were sick and they were still miserable and still had arthritis and they were still dying. And, and I'm like, there's got to be something better. And that's what really made me take a deep dive into all this. But it just amazes me that doctors just feel like that what they're doing is okay, because I mean,
I think it's brainwashing.
There's no argument. I mean, that they can't argue that what they're doing is actually helping people.
Yeah. I mean, the medical school is designed to brainwash, though. I mean, I had 2 weeks of normal human nutrition in medical school, and that should be the foundation of everything that we do. So hopefully the medical schools are coming around.
I don't know that I had that much. And if what I don't even remember, but what they did teach, I'm guessing was probably wrong anyways. So well, very nice. Well, so as we wrap up, I always ask my guests if they could give us one health tip that would make us healthier today. What would you say to that?
One health tip, it'd have to be sleep. I mean, I think that is, people value that, but they underestimate the impact in the lifelong picture. And that's a big one. As a surgeon, I got terrible sleep for 16 years. I mean, I was on call all the time. I could never sleep. And so I value the sleep I get, but it also, I paid the price. When I was 40 years old, my biologic age was 10 years older than my chronologic age. Now that I'm in my mid 50s, I've gotten it down to where my biologic age is about equivalent to my chronologic age, both by telomeres and by methylation. So I'm pretty pleased with the progress that I've made in making up for all those many years of abuse of the system.
Well, okay. Well, thank you very much for your time, Dr. Dan Stickler. And I appreciate everyone listening, and we will talk to you next time.
Well, thanks for having me.
Thank you for listening to FitRx. I invite you to share this with friends and family. If you would like, you can check out our website at vibrantlifedc.com, or you can email me at drgreg@vibrantlifedc.com.